Wellness Wednesday, sponsored by Baptist Health.
Welcome back. Every hour, a woman somewhere loses her life to a disease that's almost entirely preventable. Cervical cancer, once a silent killer, is now a battle we can win with the right awareness and action. This morning, we have Dr. Jessica Udeogu with Baptist Health Family Clinic, Rose City, with us to help us understand how early detection is so important. Dr. Udeogu, thank you so much for being here.
Yeah, thanks for having me. Appreciate it.
So why is cervical cancer such an important issue for women's health, and what are some common misconceptions?
You said some of it. It can be a devastating disease. It can be financially debilitating. So, of course, we want to prevent that in the women in our lives. And some misconceptions include thinking that you'll get it when you're older. Like that's something that you don't have to worry about when you're older. That's not true. And for people who have multiple sexual partners, that's not true either. Anybody can be exposed.
So this cancer is preventable? How so?
Yes. So through screening, getting your pap smears regularly and seeing your doctor regularly, and also through the HPV vaccine that actually prevents cervical cancer. HPV is a human papillomavirus, and it makes people more at risk for cervical cancer.
So what is keeping some women from seeking those screenings and getting the follow-up care?
Yeah, so it entails, the pap smear is a sensitive exam, and it can be uncomfortable sometimes, but it just takes a few minutes, and that is worth preventing that future discomfort and, like I said, disability, and just dealing with a debilitating disease.
So if someone gets an abnormal pap or HPV test, what should their next steps be?
They should follow up with their doctor, because because you have an abnormal test doesn't mean you have cancer. Sometimes the reason why we do this test is to catch things early, so it raises the flag for us to be like, okay, we need to take a closer look. So typically, if everything was good, follow-up would be 3 to 5 years, but you may need to come sooner once you have an abnormal. We'll need to look at it closer. Sometimes it clears on its own, but we just want to make sure we're following up appropriately.
So what message do you have for women who are watching who may feel nervous or unsure about going in getting this done?
Yeah, so preventing illness is better than curing illness. So please just follow up with your doctor. If you have questions, ask those questions. Don't be scared. I just want people to be taken care of.
All right, Dr. Udeogu, thank you so much for your time.
Thanks.
To get in touch with Baptist, head over to baptist-health.com or call 1-888-BAPTIST.